And while COVID cases have been declining and restrictions are being loosened, there are still so many questions out there. We are once again this week asking doctors in the tri-state to answer those questions, including questions from you. Joining us now, Dr. Harish Moorjani. He's the infectious disease specialist at Phelps Hospital Northwell Health in Tarrytown in Westchester County. And doctor, thank you for joining us once again.
Good evening, Will. Thanks for having me.
Our pleasure. Before we get to our viewer questions, a month ago there were 747,000 new COVID cases in the U.S. every day. Today, there's about 120,000. The trend is facing hugely downward, but it's still a lot of people. And yes, there's fatigue, but should we be a little more cautious? What are your opinions?
Oh, absolutely, Bill. I couldn't agree more. I think caution is the name of the game, and COVID-appropriate behavior, which has served us so well in these 3 waves of COVID that we have seen in the United States, should be adhered to. There's no reason to let your guard down as an individual. Mandates or not, I think everybody has a responsibility to protect themselves. Variants continue to emerge, and even though we are seeing the end of this Omicron variant, it is quite likely that another variant will emerge and has already probably emerged, because this is a worldwide pandemic. This is not about a local population, even though local factors may come to play a role in how the local governments react to this pandemic.
Yes, and when people are hospitalized, it can still be very serious. And when we stop boostering and everything else, if people stop wearing masks, and all of a sudden we've got to get masks on again, there's going to be a lot of resistance. And I know other doctors are worried, so I appreciate your view on this. Let's go to our first question from our viewer. It comes from Lori in Astoria, Queens. What antibodies number should I be looking for when I receive my blood results after recently having COVID and being vaccinated?
So antibody level tests in an individual person really don't have any clinical relevance, Bill, at this time. We don't have any data corroborating whether the level of antibody in a certain individual is protective or not. What we do know is from the vaccine trials and from other lab research data is that neutralizing antibody titers are what are reflective of protection as far as antibodies and vaccines and monoclonal antibodies are concerned. But that's not the same test as what people are getting in the lab by getting their antibody level checked.
Interesting. I do test mine every month, and I know that it's not the most relevant number, so I appreciate your candor on that. Our next question is from Joel in Brooklyn. I'm 68 and in good health. I strive to be on top of all my inoculations. Last year, I had my first COVID vaccination in January, my second in February, and my first booster in August. Although I am not immunocompromised, I think another booster shot would be prudent in March or April because it'll be over 6 months from my previous booster. Am I correct?
I don't think so at this point of time, Bill. So there is no data on a 4th vaccine, mRNA spike protein vaccine, in someone who's otherwise healthy. We do know that the booster shot, which is the 3rd vaccine, is protective across all variants, including the Omicron variant, for severe disease and hospitalization. We do not know what happens to a healthy person who has a good immune response to 3 shots and gets a 4th shot. There could be a possibility of an adverse reaction. Having said that, even if this person gets a mild illness, we now have several tools available to us, like monoclonal antibodies and antivirals, 2 antivirals that are absolutely fantastic and effective against fighting off mild and outpatient infections. So he has nothing to worry about and should not at this point of time go for a 4th booster vaccine.
A mild reaction, that's the key. We still need to vaccinate those 80 million Americans who are not vaccinated. Dr. Moorjani, thank you for joining us once again. Really appreciate it. And if you have any questions weighing on your mind, we invite you to submit them to ABC7NY. They may be answered right here on our air.